please come on through? Ah, would you like to just come and take a seat here? Thank you. Hello, lovely. How are you? Good. I'm very well, thank you. I'm Dr. Nicola, one of the specialists here. Alright. So I am, if you like, a jack of all trades. I am a rheumatologist, physiotherapist, I'm an orthopedic specialist and a podiatrist, and pretty much anything else related to the bones or the muscles. Alright. Okay, so I have a referral here from your doctor. I've had a look through before you came, but before I get into an examination, if it's okay with you, I would like to take some information from you. Alright, good. Please get yourself comfortable. Alright, okay. So, take you long to get here? Oh, it's not too bad then. Great. There is a nice fresh glass of water there for you. Please help yourself, and also some tissues if you need them. Okay, good. So, can I just get you to confirm your full name? Yeah. And your date of birth. Okay. And the first line of your address. And just the postcode. Okay. And finally, can I just take a contact number? Am I okay to send you any text messages, reminders of your appointments, or any results and things like that? Great. Wonderful. So, if I am reading correctly, you have been struggling with some extreme pain, is that right? Okay. I would just like to get you to describe that to me and your symptoms and things that you've been experiencing, okay? I will ask you a couple of questions along the way. Okay, I would just like to get a really good picture of what is going on so I can treat you properly. Okay. Please just be as honest as you can, alright? Try to think of anything, even if you think it's really minute and it's not important. It may be, so please just tell me. Alright. So, you've been experiencing a lot of pain. Roughly how long has this been going on for? Okay. So it's been around 2 years, but it's only taken you to recently to seek professional help. So has it been gradually getting worse, and has it just got excessive now? If you could just let me know. Yeah. Okay. Yeah, that makes sense. All right. Okay. So, whereabouts are you experiencing the pain? Okay, so we're talking here, right, and down between the shoulder blades. Okay, I'll just write that down. Yeah, okay. Do you get a lot of pain here as well? Yeah. What about any migraines or anything like that? Okay, so that can be combined with the neck and spine pain. Yeah. It's actually quite common for that to happen. Alright. Anywhere else? Uh-huh. Okay. So, quite a lot of places really. So we're talking all of our joints. Yeah. Is one side worse than the other? Okay, so your left side. Alright. So the worst would say is the hip, knee, ankle, and sometimes the wrist can flare up as well. Okay. What about the fingers, the joints? It's quite uncomfortable. Yeah. Okay. And you tend to pop them and things like that, pull them. Yeah. And they can ache a little bit. What about in general with your, say, your leg and things like that? How is it? Okay, so just overall pain then. Yeah. Can you describe the pain to me? Burning, aching. Yeah. So if you can't really describe it, okay, it makes sense. I know what you mean. You might think it's very vague, but I do understand what you're saying. Okay. So, did you notice any swelling anywhere at all? Okay, so the neck. Okay. Would that be every time you, say, have a flare? Yeah. Okay. So, what about sensitivity? If I was to touch your leg or your arm, or just really gently like that, would it feel quite sensitive to you? Yeah. Alright. Would that be always or only occasionally? Uh-huh. Okay. Right, so you're saying all the time, but sometimes it's quite excessive. Yeah. Any particular place? Okay. So I get an idea of the pain. It would appear that suffering with chronic pain, which is a given, which means that you've had pain for longer than 6 months and it's all over chronic pain. So, you know, you get your aches and your pains and all sorts of different pain, if you like, which is quite common. But I do think there's possibly something else going on. All right, but I just want to clarify a few other things first. All right, the chronic pain would be down to something. Okay, yeah. Right. So you'd say your spine feels like a burning sensation. Is that right? Okay. Well, that's quite graphic. Yes, I can picture what you mean. So, a kebab rotisserie, if you like, and it's going round, and you've got a hot knife that's glowing, and you say it feel like it's slicing your neck and spine. Okay, it's very interesting. Okay. Do you ever get a weird sensation in your legs, like you just want to stretch them and pull them off, if you like? Yeah. And is it worse at night? Okay. Do you ever get a cramp? And is it quite regular or not? Okay, so not really many cramps, which is good, or any spasms, right? Okay, so that's good. And you get that sensation at night. Okay. And just overall heavy. Yeah, okay. That sounds like restless legs. Alright, have you heard of restless leg syndrome before? Okay. Okay. Do you ever suffer with fatigue? Yeah, it's quite a lot. Do you find it's worse if you're in a lot of pain? Yeah? Alright. Quite lethargic. Would you say you're worse in the winter months? Yeah. Okay, that makes sense. Alright. You ever had your vitamin D and calcium levels checked? Okay, so what about your iron? Okay. Right. Tell me if you experience any sharp pain, or do you find it difficult to get up when you bend down? If you've got any clicking, clunking, squishy sounds, anything like that? If so, whereabouts? Okay, so you're struggling to get yourself up. Would you say that's got worse? What about going up the stairs? Right, a lot of pain then. Yeah. Okay, so you say squidgy, clicking, clunking, popping. Alright. Okay, that makes sense. I can understand that. Have you got any family history of arthritis? What about any joint problems? What about any autoimmune diseases? Do you go to the gym at all? When you have gone, what is it like for you? Okay, so you struggle with your knees. Okay. Right, so certain movements aren't brilliant. It's stuck and you're very wobbly. So you say you're quite clumsy. Yeah. Okay. Have you ever felt like you've had the flu but actually haven't, and you haven't had a temperature but you feel like you've got a fever? Is that often, or? Okay, so very rarely, but that has happened to you. And if you had pain at the same time? Okay. Any issues with your digestion? Okay, so you have irritable bowel syndrome. Okay. When was you diagnosed with that? Okay. Any allergies or anything like that, or intolerances? Okay. Any mental health problems at all? Okay. Depression, sometimes anxiety, but controlled. Okay. Okay, so you do have a long history of mental health, quite complex issues then. All right. But all okay at the moment? Good. Okay. You all right? Good. Not too long now on the questions, alright? I just want to be as thorough as possible. The more I know, the more I can help you. Okay. Alright. Has anyone in your family got any health issue that I need to be made aware of? Any like spine issues or anything like that? Okay. Okay, so that was the spondylitis, depends how you say it, and spine, latest positive. Okay, have you been tested? Okay, any scans or MRIs, CT scans, X-rays or anything like that? Have you had any of those done on any of the areas that you suggested? Okay, no you haven't, right. So you had nothing at all like that. What about seeing anybody for your migraines? Okay, so not particularly. Yeah. Do you take anything for those? How often? And what about any other pain relief? Do you take anything on a regular basis? What about any anti-inflammatories? Okay, so you've had oral, tramadol, migraine relief. It's cocodamol. I hope you don't take them all together. I didn't think you would, but I have to check. Alright. And occasionally some naproxen. Alright. Got any other health issues I need to be made aware of? Okay, so asthmatic. Is it controlled or up and down? Okay, bit iffy at the moment. Alright. Hay fever. Is that every year? Okay, hit and miss. Alright. And scalp psoriasis, okay. How long have you had that for? Oh wow, so years and years. Alright. Does it move around a little bit on the scalp sometimes? Excessively itching. Alright. Have you ever had periods where it's fine? Okay, so very rare. And ups and downs, sometimes worse than others. Okay. What about at the moment? Oh, that's really good. I'm glad to hear that. Okay. Are you on any medication? Okay. Take any vitamins or minerals? Okay, no. Fine. Do you smoke, vape, drink alcohol? If so, how much? Recreational drugs? Okay. Perfect. Which inhalers do you take? Right, okay. I take it you don't have anything for your IBS. Okay, so just bust them if you need it. Okay, that's fine. Do you ever take Imodium or anything like that? What about laxatives? Okay. That's fine. Okay, that's fine. It's not a problem. Good. I've got a really good picture now of everything that's going on. Alright, I'm sure there's probably other things that we haven't covered. Things pass, through our mind and, it's perfectly normal. But talking about your mind, would you say that you can be quite forgetful? Okay, what about your balance? How's your balance? Strength, how's your strength? Wonderful. Okay. Do you have regular health checks at all with your doctor? Okay. Up to date with your eye examinations and dental? Good. Right. So, thank you for sharing all that with me. I really appreciate it. I know it's probably quite difficult for you. Oh, it's all right, lovely. Oh, it's okay. Shh. Oh, don't get upset, honestly. Oh, I know. I can understand that. It must be absolutely horrific to live with. I know. But it's nice to hear that you do have, a reasonably normal lifestyle, which is fantastic. You just kind of fight through it, which, it's something to be proud of. Alright, it's really good. Alright. Alright, take a tissue. Alright. Okay. Are you alright for me to carry out the assessment now? Good. Right, first things first, I would like you to stand up for me. Okay. Stand up normally. Okay. Just relax your knees as you would normally. Okay. Alright. Just bend your knees for me. Oh wow, yes. That sound is terrible, isn't it? March on the spot for me. Okay. What about like your stepping? Do some steps for me. Yeah, I can really hear that. Alright. It's a little bit uncomfortable. Alright, you can stop. It's fine. I want you to do a squat for me. That's it, another one. You can't do that very long, can you? And another one? Alright, okay. Just relax. Don't worry. I can see that was very difficult for you. Can you bend over and maybe touch your toes, or as best as you can? Would you say you're quite flexible at times? Okay, relax. You're doing really well. Okay. Just looking at everything. Okay, raise your arms right up for me. Keep them there. Alright. Okay. Good. Relax. Do it out for me. And hold them. Okay, relax. It's fine. Can you do this action for me? Alright. What about that? Okay. Relax. Stand with your legs wide apart for me. Okay, do the star jump for me. Great. I bet you didn't think you were coming for a workout. Don't worry. I won't be getting you to do too many things. Good. So, if I can get you to stand over here by this light, if I could get you to just walk as you would normally all the way across the room for me. Okay, when you're ready. That's good. Good. Alright. And just do a tiny bit backwards if you can. Alright, don't worry, you can stop. Good. Turn round. If I could get you to walk like so. It's alright. Alright, that's fine. Okay. Good try. Now, if you'd like to come back over here. Okay. Can I get you to balance on one leg as best as possible? Try the other side. Good. Can you maybe hop for me? Okay. Good. You can relax. Take a seat. Okay, if you can sit as you would normally in your chair, so if you slouch or whatever, just sit normally. Okay. Okay, relax for me. Okay. Now, sit upright for me. Shoulders nicely back, like so. Okay. Any pain anywhere? Okay, lower back, yeah. It's quite common because we're not used to sitting like this. Some people might be, but not many people are. Okay. Good. Okay, just get yourself comfy. What I would like you to do is pop your head down for me. Okay, and could you pop it right back for me as best as you can? Any pain when you do that? Okay. Can we go that way? And the other way. If you can move our head up, down, up, down. Keep going. How's that feel? Uncomfortable. Alright. What about left, right, left, right? Same, uncomfortable. Right. Okay, you can relax. When you were younger, did you have a lot of neck issues at all? Did you pull your neck a lot? Okay. Any other issues with any parts of your body? Okay, so you had shin splints. Okay, so when you were at school and things like that, did you also do PE or? Okay, so you didn't do it quite a lot. Shin splints and knee issues. Interesting. So it has been going on quite a while then. What about the neck? Any of your family members tell you about any neck issues as in back here? Okay, interesting. Any car accidents at all or? Okay. Whiplash, neck strain? Okay, that's fine. Right. Now I've got you to do a little bit of a workout. What I would like to do is just have a feel on different areas on your body. Okay. So, if I could start by having a look and a feel down your arms, alright, and then I'll go into your fingers and your wrist. Okay. And just keep your arms straight out there for me. Just relax in my arms. That's it. Thank you. What's that like? It's quite light and touching. Okay. Just go around the shoulder. Okay. Move your arm out. Back down for me. Go around your hands. going to rotate your wrist. Oh. It's always like that. Does that hurt? I'm just going to pull your fingers. Oh. They always like that. Does that hurt at all? Okay, I'm just going to pop your arm up. What's that like? It hurt or not? Okay. Then down. Other side. How's that? Sphere in the shoulder. Just move your arm out. Okay, back. So to rotate your wrist. Okay, to pull your fingers. Any pain? Okay. Right. Just bring your arm up. Okay, and bring it back. Okay. Relax. You're doing really well. I just want to feel along your collarbone. Right. You say you've torn a ligament here before, is that right? Okay. Yeah, you will just get some pain. In the cold and things like that, you know. Okay. Oh, so you've severely fractured 5 ribs. Oh, goodness. Any pain when I touch? Cold triggers it off, yeah. What about the elbows? You never really mentioned that. How? Okay. So you chipped one of them. Okay, which one? The left one. Okay. Sometimes, yeah. How old? How did you do that? Yeah, over the handlebars. I remember things like that. It wasn't pleasant, was it? Just check this elbow. Okay, that's fine. Right, I'm happy with that. I'm just going to feel around your glands, okay? Do you ever have any swelling in your glands? Any pain at all? Okay. Now, what I'm going to do is go around and have a look at your back, okay? So, you just stay there. Right, I'm going to get you to move your top for me. Thank you. Yeah, I can see there actually where it's swollen. How's that feel? Okay. I'm just going to rub like I'm massaging. Oh yes, I can feel a lot of popping there. Feel the knots. Have you ever had a sports massage or any holistic treatments, massage, anything like that? Okay. I'm just going to go down around the shoulder blades. What's that? Okay, so you have a shooting pain. Where's that going? So on the left, just around there. Okay, and down your arms. Okay, so just the one side. Do you get that when you've had massage before? Okay. So nothing there. Okay. That's fine. Okay. Right. I'm going to push down your vertebrae. Okay. How's that? Tender. So strange. Bit tingly. How is it when I'm just touching? I'm just going to feel around your pelvis, okay? Okay, back up the spine. Okay. And just bend for me. That's it, down. Just back up. There you go, brilliant. Okay. Right, you can pop your top back on. Okay, I'm just going to come back and have a look at your legs. You're doing really well. Okay, so if I could get you to just rest your foot here for me. Okay. You get any pain in your feet at all? About there or not? Okay. Is that tender? Okay, I'm just going to rotate your foot. So pull on your toes. A little bit of clicking there. Okay. Okay, I'm going to get you to do that for me. Okay. Just going to feel up the back of the leg slightly. Pull that back. Same again the other side. Okay. Put that. Okay. Bit tender again. Wonder if you might have flat feet. Okay, just going to rotate. Okay, bit up and down. Pull your toes. Okay, stop your leg. Okay, I'll put that back. Okay, you feeling all right? Okay, what I want to do now is I'm going to get down on the floor and I'm going to get you to stand up for me. All right, but if it's okay with you, I would like to have access to your legs properly. All right, so if I can get you to just remove your bottom half, and you can just grab that towel there and just place it around you a little bit. All right, okay, perfect. Comfortable? Good. So I'm going to feel around your pelvis, the groin area, down your thighs, check your knees, and then back down your calves again. All right. Okay, can I get you to squat for me? Back up. Going to go down the front bit of your pelvis. Okay, pain or anything? Okay, you just stand slightly with your legs apart a little bit. I'm just going to feel down the groin area, just making sure I keep just to the edge. Okay, and the other side. Good. Okay, I'm now going to feel down your legs. Any pain or anything? Okay. What about that side? Okay. Good. Right, I'm now going to have a good feel of your knee. How's that? Okay, can you just squat for me? Yeah. I'm just going to press in where your core is. Tender? Okay. Let's check this side. Squat for me. Yeah, sounds that. I'm just going to press in the cartilage area. How's that? Oh, okay. Alright. I'm just going to get down the calf now. Okay. Press along the shin. How's that? Good. And finally the other side. And press down the shin. Perfect. Okay, if you would mind popping your bottoms back on and we can carry on. You alright? Good. I'm just going to jot some notes. You just relax for me, okay? I would like to just check some reflexes. Alright, just stay there for me. Elbow. Just up there. Okay, your wrist. Just want to check the middle of your hand. Side, elbow, your wrist, and of your palm. Okay, your knee. And your ankle. Okay. And your ankle. Okay, you just your foot like that for me. I'm going to do the centre of your sole of your foot. Just do that side. Okay. Just want to check your knee again with this one. All right. Okay. Give me your palms. I'm going to point with this. Feel that? Okay. The one. Okay. Put your foot back for me. How's that? Good. Again. Okay. That's fine. Can you feel that? Good. That. Okay, so you feel that motion was good. And I want to do the same upper arm. Okay. And your forearm. Good. And your thigh. And your calf. Okay. Perfect. I'm going to post it there. Excellent. Feel all that all fine. Okay, good. I have this brush. Okay. I can get you to close your eyes for me. Just tell me if you can feel that. Good. Wonderful. Would you say it feels soft? And it all feels quite even. Good. Keeping your eyes closed. Can you feel that? That. Good. Can you feel that? And would you say that feels different or the same? Okay, so one's rounded, which is that one. Yeah, that one. This is pointed. Yeah, feel the difference. Okay, and just tell me which one's which. Good. Yeah. Well done. You can open your eyes. just going to squeeze different areas, okay? The cheek first. Your neck. It feels a bit strange, sorry. Good, well done. Shoulders. Upper arms. Forearm. Okay, your thighs. Calf. Okay, I'm just going to trace that. Check your hip. And outside of your body. Good. Okay, we'll pull that down. One more thing I would like to do. Okay. What I'm going to do is touch different points. I'd like you to tell me if it hurts, any weird sensation, or anything like that. Okay. And okay, I'm just going to start by your hip. On your tummy. Alright, you can relax now. It's the examination over. Bet you're relieved, aren't you? Okay. I think you have what we call fibromyalgia. Have you heard of that before? All right. So, rheumatologists can assess for that, but there is a lot of strong evidence now to say that it's actually an autoimmune disease, all right? There isn't nothing official yet, but it is on its way. So then we could look at getting neurologists involved as well. All right. I also think you have joint hypermobility syndrome and flat feet. All right. And this is going to sound quite dramatic, but don't worry. This will explain all your symptoms. All right. So the fibromyalgia, you're going to get excessive pain. You could experience flu-like symptoms, but no fever. You can have the burning sensation. You're really sensitive to touch, like you were describing. Okay, and you can have the fatigue, lethargic, and all those type of things as well. It's quite complex. There's a lot involved in that. All right. Flat feet. I mean, you're okay with that. I think. I don't think we need to do any corrective surgery or have any special shoes or anything like that. All right. The joint hypermobility, I mean, you're quite flexible, clumsy, balance isn't 100%, and you've got the pain in the joints and the noises and things like that. Okay, I'm wondering whether you might have a form of arthritis, whether it's rheumatoid or something else, potentially, you know, it could be a number of things, different types of it, osteoarthritis and things like that. Could just have it in one area, so your knees or something like that. Could be more than that. I am thinking that you might have this ankylosing spondylitis. Okay, so I will need to check for the gene HLA-B27. Okay, and then can check that out. So what I need to do, all right, is get you in with my senior nurse. All right, I'm just going to do your blood test. I'm going to check for vitamin D, calcium, full blood count, liver function, kidney function, hormone levels. Okay, the gene, iron levels, and glucose, and I think that might be all. Okay, she will also carry out a health check on you. So she'll check your height, weight, blood pressure, do peak flow, pulse, oxygen levels, listen to your chest, things like that. All right, okay. Once that's done, I would like you to have some scans. All right, so MRI, CT scan, x-rays and things like that. So there will be quite a few, so it will take quite a lot of time. You'll be here for quite a while. All right, so you'll be having all the different scans and things like that. So I'd like that done the same day. So you see the nurse, and I'll make sure that the blood tests come back within the hour. Then if I can get you in for the different tests, you will be exposed to higher amount of radiation than normal. Would that be okay with you? Okay, that's fine then. And then depending on that, whether I do any other kind of tests and things like that. All right, it just depends on what we find. Okay. Then on another date, I would like you to come and see the neurologist here. And what I'm going to get those to do is carry out what we call a cranial nerve exam. All right. So they're literally going to assess everything, your sensitivity, your strength, and your, muscle function and all sorts of different things like that. I'm not 100% because I'm not a neurologist. They're very, very clever. So I would have to get you in for one of those. Then you can round everything up all together. All right. The neurologist will decide if they want you to have any brain scans or anything like that. Okay. Please don't be alarmed by all these things. All right. It sounds a lot worse than obviously they are, but don't worry. I just want to be as thorough as possible. Okay. Then I'm going to get you back for a follow-up and have a chat about everything, treatment and all sorts of things like that. How does that sound? Perfect. It's very complex, a human body. All right, and I will sort this out for you. Do you have any questions for me? Okay, that's fine. Wonderful. Yeah, that's right. So they'll be checking your ears, your hearing, your vision, and all sorts of different things like that. Yeah, just do a little bit of Googling, you'll be fine. But don't listen to all the horror stories, all right? Okay. Right, my love. It's an absolute pleasure to meet you. And if you wouldn't mind seeing my lovely secretary at reception, she'll be able to book you in all those appointments. All right. You take care now. Bye-bye. Hello, lovely. How are you? Good. I'm Dr. Nicola, and I'll be carrying out your cranial nerve exam today. Have you had one of these before? It's nothing to worry about, okay? I'm just going to be carrying out a range of different tests. Some are actually quite fun. All right. Okay. So let's begin. First of all, if I can get you to just look straight ahead. That's it. Just focus straight ahead. Wonderful. Keep looking straight ahead. Perfect. Keep looking. Good. Wonderful. Look at my nose. Fingers. Nose. Fingers. Good. Nose. Fingers. Nose. Fingers. Perfect. Fingers. Nose. Fingers. Nose. Fingers. Nose. Fingers. Nose. Perfect. Fingers. Nose. Fingers. Nose. Fingers. Fingers. Nose. Nose. Excellent. Well done. Keep looking straight ahead at my nose. Don't let my finger distract you. So don't look at the finger, no matter how much you want to. You can do it. Good. Perfect. Keep looking at my nose. Don't let the hand distract you. That's it. Good. Keep looking at my nose. Wonderful. Keep looking at my nose. Keep looking. Good. Keep looking at my nose. at my nose. Wonderful. Keep looking. Good. Don't worry, I'm not going to poke you in the eye. Keep looking. Don't focus on the fingers, focus on my nose. Well done. That's really good. Look at my finger. Follow it. Just your eyes. Not your head, your eyes. Good. That's it. Well done. Good. Yeah. Well done. Okay, now focus on my nose. Don't look at my finger. Set my nose, not my fingers. Good. Not too bad. Nose. That's it. Well done. Perfect. Now I want you to look at my nose. This light is quite bright. I don't want you to get distracted by the light, so you must keep looking at my nose. You ready? Here we go. Yes, very bright. That's it. Look at my nose. Focus. Focus on my nose. That's it. Perfect. Don't let the light distract you. I know you want to look at it, but you're not allowed. Look at my nose. That's it, my nose. Good. Wonderful. Keep looking at my nose. Well done. Nose. Don't let it distract you. I know you want to look at my light, but you're not allowed. Well done. Now I want you to follow my light just with your eyes. Not my nose. That's it, the light. Good. Just the light. Well done. Good. Well done. Keep following the light. Perfect. Well done. Well done. You can look at my nose. I'm going to have my fingers here. I want you to tell me which side you see move, but you must focus on my nose. Okay? Good. Yeah. Okay. Good. Yeah. Keep looking at my nose. Perfect, well done. Got my nose. I'm going to move out. If you can tell me when you can't see it anymore. Okay. Ready? Keep looking at my nose. Good, that's it. Well done. Good. Same again. Yep, keep looking at my nose. Well done. Concentration's very good. Great. Now I'm going to bring them back in. Okay, look here. Good. Well done. Same again. Yep. Wonderful. Well done. Now, staying with my nose, I'm going to have my hands either side, and I'm going to be putting up different amounts. If you can tell me how many. Okay, but keep looking here. Ready? Perfect. Wonderful. Good. Keep looking at my nose. Perfect. Brilliant. Going to do the same, but a little bit closer. Okay. Good. Yeah. Good. Excellent. Well done. How's that for you? All right. Good. Look at my nose. Look here. Nose. Look here. Nose. Look here. Nose. Look here. Look at my nose. Here. Nose. Here. Nose. Here. Nose. Here. Good. Now I want you to look at my nose. Look here. There. There. And on my nose. Good. Wonderful. Well done. You feeling all right? Great. You're doing very, very well. I'm very pleased. Okay. Look at my eyes. Look at that eye. That one. That one. That one. That one. That one. Nose. Nose. That eye. That one. Nose. Perfect. Well done. Now, what I want you to do is not blink. Okay, so you need to make sure you don't blink. I'm going to come close to the face, but I want you to try and not blink for me. Okay, ready? Nearly. Try not to blink. You're blinking. Good try. Okay, blink. Well done. Let's do it again. Ready? No blinking. You blinked. No blinking. Good. Well done. Nearly. Good. Wonderful. No blinking. Blink. All right, let's try again. No blinking. Said no blinking. Not bad. Okay, blink for me. Okay, and again. No blinking. No blinking. Good try. Well done. Now I want you to blink for me. Blink. Blink. Blink, blink. Blink, blink. Good. Blink. Blink, blink, blink. Good. Blink. Blink, blink, blink. 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 Blink, blink. Well done. Let's do some winking. Wink. 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 Wink, wink. Wink, wink. Good try. Let's combine the two. Blink. Blink, blink. Wink, wink. Wink, wink. Blink, blink. Good attempt. Wink, wink. Wink. Blink. Wink. Blink, blink. Wink. Blink. Wink, wink. Good. Blink, blink, blink. Wink, wink, wink. Blink, blink. Wink, wink, wink. Perfect. Blink, blink. Wink, wink. Blink, blink. Wink, wink. Excellent. Well done. Not too bad, but it's expected. Perfect. Well done. How are you feeling? Wonderful. Look at my nose. Keep looking at my nose. Well done. Good. Look straight ahead at my nose. Good. Keep looking straight ahead. Perfect. Look at my nose. I'm going to look in your eyes. Okay. Focus. Good. Look straight ahead. Keep looking at my nose. Good, well done. Keep looking at my nose. At my nose. Well done. Good. Well done. If you can look up for me just with your eyes. Good. Look that way. And that way. Okay, relax. You do really well. Okay. Look at my nose for me. Look here for me. Keep looking there. Excellent. Keep looking here. To your eyes. Excellent, well done. Let's let your eyes adjust. Okay, good. Look there for me. Good. This is my eye chart. If you can read the rows I point to. Can you read any of these? Okay. Cover one eye for me and read the rows I point to. Can you read any of those? Okay. Cover that eye for me and read the row I point to. Can you read any of those? Okay, and cover your eyes. Can you read the bottom row? What about that row? Cover that eye for me. Can you read that row? That one. Okay. Can you cover that eye for me? Read that row. And that one. Okay, uncover your eyes. Which row is the clearest? Yeah, I thought you'd say that. Which is the hardest one to read? Do you want to give it a go anyway? Okay. Okay, cover that eye. Same again. And cover that eye. Same again. Okay, good try. Just look at my nose. Okay, looking at my chart. What colour is that? What colour is that? Cover that eye for me. What colour is that? That one. And cover that eye for me. What colour is that? And that. All correct, well done. What colour is that? And what colour is that? What colour is that? And what colour is that? Good. Now look at my nose. Keep looking at my nose. What colour is that? Yep. What colour is that? Good. What colour is this? Keep looking at my nose. What colour is that? Perfect. What colour is this? What colour is that? Okay. What colour is this? And that. Cover that eye. What colour is this? And what colour is that? Cover that eye. What colour is that? And that. Good. What colour is that? Okay. Uncover. What colour is this? And that. Good. Cover that eye. What colour is that? That. What colour is that? That. Good. And cover that eye. What colour is that? And that. Good. And what colour is that? And that. Perfect, well done. Colour blindness. So here we have speckly circles, different colours, some might be easier than others, and there's different shapes in them. I just want you to tell me the shape. Okay, what's this? Good. That one. Good. You got that right, don't you? Yep, that's correct. Good. Yep, perfect. That's right. Good. And the last one. Well done. Colour blindness. We have the speckly circles again, but this time there's numbers in them. Okay. Good. 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 Okay. Yeah. Let's try this one. Okay. Let's do that one. Good. Last one. Well done. Fantastic. Well done. Feeling all right? Good. Okay. Here we have a dice. What colour is this? And what colour are the dots? Good. That's right. Red and black. So, what I'm going to do is point to one of the faces, and I need you to tell me how many dots. Okay. Ready? Good. And how many is that? Good. How many is that? Good. How many is that? Yep. How many? How many? Good. How many? How many? Okay. Close that eye for me. Same again. How many? How many? How many? How many? Good. Close that eye for me. How many? How many? How many? How many? Well done. Uncover. See all that okay? Yeah. How many? How many? Mm-hmm. Good. Sorry, I covered that one up. Mm-hmm. Good. Mm-hmm. Excellent, well done. I have some cards here. We have different categories, okay? We have tools, animals, food, and transport. Any particular one we'd like to start with? Let's go for animals then. I'm going to show you the cards and I want you to tell me what animal it is, okay? Mm-hmm. Good. Okay. Now, can you tell me as many as you can remember? Mm-hmm. Good, yeah. Any more? Good. Good try. I'm going to show you 3 cards. And we have a cat, we have a dog, and we have a horse. I'm going to show you them and I want you to tell me the order back, if that makes sense. So I'm going to show you the cards, tell me the order. Okay, ready? What order? Good, well done. Again. And tell me the order. Perfect, well done. That's fantastic. Let's do food. Okay. Can make me hungry. Oh, my favourite. Minus the peas. Another of my favourite. Good. Another one of my faves. Okay, I'm going to pick 3. Okay. We have sandwich, fish and chips, and afternoon tea, you'll say, scone and tea. I'm going to show you them, and if you can just tell me the order. Well done. Again. Tell me the order. Excellent, well done. Okay, tools. If you don't know the name of them, just do your best. Because I don't really know the name of these either. So I only know it because it's my job. Excellent. Okay, got some easy ones. Okay, we have a hammer, a drill, and screwdrivers. Okay, I'm going to show you them in an order. Okay, ready? The order? Good. Okay. The order. Okay. Last one. And the order. Excellent, well done. And transport. Okay. What's that? Good. Yep. Well done. So I'm going to pick 3. Okay. So we have a plane, car, and a train. Okay. What's the order? Good. Good. And last one. and the order. Good, well done. Okay, the animals that we did, can you just tell me as many as you can remember? Any more? Yep. Good, well done. Okay, I have the tools. Tell me what you can remember. Yep. Any more? Okay, out of food. Good. Not too sure. Okay, that's fine. And what about transport? Yep. Good. Well done. Which one was easy for you to remember? So is it transport, tools, food, or animals? And why do you think that was? Okay. Thank you very much. Look at my nose. You tell me what colour that is. Good. Look at my nose. Look at my nose. Look at my nose. Well done. How are you feeling? You're doing really, really well. So far, I'm very, very impressed. Okay. Right. Let me get these. So, I have these, and they are very, very soft. Hold out your hands. They feel soft. Squeeze them for me. And rub them. this one feels softer than the other? This one? Okay. Which one feels rough then? This one? Good. They are slightly different, as you can see. This one is very soft. This is very soft, but it's a little bit more coarse. Okay. Can you feel all that? Good. Close your eyes for me. Can you tell me if it's the soft one or the coarse one? Okay. Good. Well done. Yep. Good. Okay. That's good. I'm just going to touch your ears with them. Okay. That feels soft. Good. Feels soft. Okay. The other one. The other side. Right. If you can tell me if it's the soft one or the coarse one. Okay. Good. Fantastic. Pop your hands out in front of you. Same again. Good. Excellent. You can open. What colour is that? And that one. Okay. So these are the same but small. Okay. They are nice and soft. Pop your hands out. Feel them? Okay. So, you feel that? Yeah? Perfect. Can you feel this? Good. Now, I want you to tell me if it's big or small. Look at my nose. Okay. Good. Great. Close your eyes. Same again. Okay, same on the ears. Perfect. Pop your hands out. Same again. both of them. You tell me which one is the small one and which one's the larger one. Good, you can open. Well done. I have this Q-tip. I want you to look straight ahead. I'm going to poke different parts of your face. Okay. Good. You feel all this so far? Good. Close your eyes. Feel all that. Good. Open. If you can feel that and that, can you feel the difference? Okay. Look at my nose. Feel the difference? Okay. Just keep looking at my nose and I want you to tell me which is which. Okay? Good. Good. Close your eyes. Same again. Good. Keeping them closed. Excellent. Well done. Hands out. Finger, yeah. Q-tip. Okay. Which one's which? Excellent. You can open. I have these lovely fluffy brushes. Okay. Different sizes. Hands out. Small. Large. Large. Small. Okay. Look at my nose. Feel that? Good. Well done. And it's lovely and soft, isn't it? Great. Keep looking at my nose. I want you to tell me which one's which. Is it the smaller one or the larger one? Okay. Fantastic. Close your eyes. Feel that? Good. Feel that? Good. Tell me if it's the smaller one or the larger one. Good. Good. On your ears. Small or large? Small or large? Good. Hands. Okay. Brilliant. I'm going to pop some air on your face. If you can tell me if you can feel it. Okay, can you feel that? That. Pop your hands out. Good. Close your eyes. Your ears. Hands. Feel all that? Good. Just want to check your reflexes, okay? Let's start with here. Elbow. Elbow. Okay, and your knee. And down by your ankle. Knee. And ankle. That's perfect. Look straight ahead. You feel all that? Okay. Just watching the skin now. Close your eyes. Good reaction. Okay. Okay, you can open. Here I have some of these. Okay, give me your hand. Squeeze for me. And again. Good. Swap hands. Squeeze. And again. Good. take that back, thank you. Another one. Give them you. Squeeze them both. Again. Again. Okay. All right. Can you squeeze the left? The right? Left? Left? Right? Right? Both? Excellent. I'll take those back from you. I have this little cute thing, and it is so spongy soft. Okay. Can you look here? Keep looking there. Look at this one. That one. That one. Good. Keep looking at this one. Don't let the finger distract you. Okay, look at this. This one. Good. I'm going to pop this on your face. How's that feel? Good. Okay, give me your hand. Thank you. Squeeze that one around. Okay, up to the other hand. Okay, now look at me. As you can see, different strengths make it go different levels. Okay, so I want you to press it firm and then light, and let me have a look. There you go. Firm, good, and light. Okay, squeeze as hard as you can. Have a look. And the other hand, squeeze as hard as you can. Let me have a look. Okay. This is a unicorn cake. Look at the nose. Its eye. That one. Focus on the eyes. That's it. Keep looking. Good. Keep looking there. Okay. Wait for it to pop back up. What colour is that? That. That. I'm just checking. Okay, so I'm going to give you the cake. Now can you squeeze for me? Let go. Not bad. Just let it pop back up. Squeeze again really hard. Let go. Now squeeze lightly. Much better. And again. Okay, I think I'll take that. I do love waffles. So looking at the waffle, okay, what colour? Good. Keep looking here. Keep looking at the yellow. Okay, have that. Squeeze. Good, well done. Peel around. What do you think? Squidgy? Soft? What else? Yeah? Okay, I'll take that from you. Thank you. Look there. 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 Good. Look at the pink blob. Look at the white of an eye. Look at the left eye and the right eye and the yellow square. Good. What shape's that? This one? That one. Okay. Put the orange. Put the yellow. Put the black. And the brown. Good. Now I just want you to focus on this cute face. Just keep watching it. What are your thoughts when I'm squeezing it? Do you want to touch? Yeah? You want to squeeze it? Yeah. Okay. Look there. Look there. Excellent, well done. Hold your hands out, pop that down. Okay, with the other hand, feel the eye and the yellow bit, the orange, the brown. Do you think they feel slightly different in places? Good. Well done. Okay, I'm going to do a little bit of a hearing test. I'm going to make a noise and I want you to tell me which side, okay? Good. Perfect. I'm now going to squidge these a certain amount of times. Can you just tell me how many times? Ready? Mm-hmm. Good. Yep. Yeah, it's both. Same again, but with my fingers. Okay. Tell me which side you hear. Yeah. Good. Just put these in. Can you hear that? Good. Right, I'm going to pop these. I want you to tell me how many times I pop. Okay? Ready? Mm-hmm. Good. Yep. Mm-hmm. Great. Perfect. Mm-hmm. Good. Okay. Ready? Mm-hmm. I've got a moment. Pop them back. Okay. Good. Okay. Well done. Ready? Good. Yep. Okay. Ready? I've got a moment. Good. And one more. Just pop some up. Ready? Wonderful. Well done. Okay. Just having a feel around, okay? Other side. Don't feel okay. Perfect. Feeling good? Good. I'm just going to whisper some words and I just want you to tell me what it is. Okay. Chocolate. Cucumber. Sausages. Good. Side. Pineapple. Coconut. Good. I'm now going to say 3 words, and I just want you to repeat it back to me. Trigger, sleep, relax. Whisper, good, lovely. Tick-tock, sausages, chocolate. Sleepy, banana, hazelnut. Hello. Okay, let's do 3 more. Sausages, chocolate, pineapple, cucumber, tick-tock. Hello. Excellent. I'm going to say it here and whisper. If you can repeat the word. Sleep, chocolate, hazelnut, sleepy, pineapple. Good. Over here. Good. Okay. Tick-tock. Chocolate. Again. Tingles. Cucumber. Sausages. Good. Now I'm going to say 3 words, if you can repeat them. Chocolate, sausages, pineapple. Good. Tingles, triggers, sleep. Okay, and again. Sausages, raspberries, strawberries. Bananas, apricot. Good. Excellent, well done. Your hearing is very good too. All right. Okay, just have a couple of scents that I would like you to tell me what it smells like. Okay. Take a nice sniff for me. What's that? Good. Take a nice sniff for me. What's that one? Good. Final one. And take a sniff for me. Excellent, well done. Very good. Now I just want to have a little feel around your face, if that's okay. Good. Scrunch your eyes. Your face, yeah. Open wide with your eyes. Open your mouth wide. Chew. Good. Open and close your mouth. Good. Suck in your cheeks. Puff out your cheeks. Frown. Smile. Pull a sad face. Pout. Good. Puff out your cheeks. Relax. Suck in your cheeks. Okay. Raise your brows. Perfect. Pop out your tongue. Hold it. Wiggle it around. Pop it in the bottom. Top. Like that. And the cheek. The other one. Can you pop your tongue on the roof of the mouth? Can you rotate it? Okay, put your head back for me. That way. That way. Rotate and circle. And back the other way. Your chest. Good. Push in the shoulders. Try to raise. Good. Relax. Your hand. Try to push against me. And squeeze my hand. This side. Push against me. And squeeze. Excellent. Everything is now complete. I must say you are absolutely amazing. All your cranial nerves are working as they should. All right, I'm very, very impressed. Do you have any questions? You take care now. Bye-bye. Hello, lovely. Are you all right? Good. My name's Yvonne. I'm one of the nurses here at the practice. Dr. Nicola asked me to see you to carry out a health check. Is that what you're expecting today? Oh, good. That's all right then. So it's nothing to worry about, okay? I'm just going to do some basic checks and I'm going to carry out a urine test and a blood test, which will be at the end of the appointment, okay? I will also have a little chat about your medication and, if it's okay with you, a brief mental health assessment. Would that be all right? Oh, perfect. That's good. So, first things first, can I just get your full name? Thank you. And your date of birth. Thank you. Can you just confirm your first line of your address? Excellent. And your postcode. Good. Thank you. So, I hear you're having a lot of problems. Yeah. Struggling a little bit, aren't we? Okay. You're in very safe hands. Dr. Nicola is very good. So don't worry. Things will be sorted for you. Okay, my love. But we will have a little bit of a chat towards the end, okay? Good. So, do you know your height? Good. And what is your weight? Are you aware? Okay. Can I get you to just pop on the scales then, please, so I can just double check? Okay, thank you. It's just there. Okay. Oh, perfect. Close enough. Okay. Good. Okay then. So. Just going to check your pulse and your oxygen level. So I just need a index finger. Okay. Ah, thank you. Okay, keep nice and still for me. Okay, that's not too bad. Fantastic. Okay. Just going to check your temperature, okay? That's perfect. When was the last time you had your blood pressure checked? Okay, so you can't quite remember. Alright, don't worry, I'm going to do that in a moment, okay? Good. Okay, I'd like to have a little listen to your chest if that's okay. Great, thank you. Let's try and make that a little bit warmer. It's always the worst, isn't it, when you pop it on and it's cold. Okay. Am I right to continue? Okay. Is that okay? You just take a couple of deep breaths. That's good. I'm just going to keep it there and just check your pulse. Thank you. Okay, thanks. Chest is nice and clear and your heart sounds nice and strong, so that's good. Okay. Comparing the pulse with the little monitor, it is a little bit on the fast side. Yeah. Do you find that you often get a lot of palpitations or? Okay. Yeah. Alright, well don't worry, I'll check your blood pressure anyway. Okay, yeah. Can I just take that on? Thank you. Right, so that just that. So thank you. Comfy. Good. Feeling okay? Good. Okay, keep nice and still for me. It's going to go quite tight. Your blood pressure is appearing quite high. Have you ever experienced high blood pressure before? Okay. Yes, it's definitely at a level that we should be monitoring. Okay, yeah. But please don't stress because that's not going to help. All right. Just going to check. Yeah, so comparing your height and your weight, you are overweight. Yeah, I don't like to say that, obvious reasons, but yeah, that's okay. Yes, that's right. So it could be adding to the pressure on your joints, okay? And that could be why your blood pressure's up. Yeah. Okay. So you find your asthma's a lot worse as well. Okay. That could be all to do with everything, to be honest. Yeah. All right, so let me just jot that down. Thanks for mentioning that. I'll talk to you a little bit about that later. Okay. Yeah. Yeah, I mean, you look fantastic. Yeah, I think it's more to do with getting fitter, getting healthier. Yeah, getting that blood pressure down, getting the pulse down a little bit, and to take the pressure off your knees and your spine and things like that. Okay, yeah, all right. But please don't stress about that at all. Yeah. Okay. That's fine. Right. So, can you just confirm what medication you are taking at present? Mm-hmm. Yep. Okay. And are these all for mental health, or are you taking the lamotrigine for epilepsy? Okay, so mental health, okay. And how long have you been on those medications? Mm-hmm. Okay, so you... Right, that's good. So you don't think they are hindering your weight and things like that. Okay, that's really good. Yeah, I mean, that's the thing, isn't it? I mean, you know, we've been restricted a lot for the last couple of years, not being able to get out and about and, you know, exercise and things like that. It's been a little bit difficult, and then stress levels have been through the roof, so, you know, it's understandable. And then working at home, you're not particularly, you know, moving around a lot, are you? So yeah, that's, you know, I mean, myself, I have, so, you know, it's nothing to be ashamed about or worry about. Okay, yeah, don't worry. Yeah, okay, that's good. So they are well controlled medication, everything's going all right with them, you've got no problems or anything like that. Okay, brilliant. Do you have any other diagnoses of anything at all, whether it's physical or mental? Okay. And how is the IBS? Okay. Have you got any allergies? Okay. Yeah, to be honest, my hay fever started as well. Yeah, it's flaring up a little bit, you could probably tell. And for some reason it's always worse at night though, so the day's not too bad, you know, but getting on to this evening, I bet it will be getting quite worse. Do you find that as well? What about your asthma? Yeah, okay. Brilliant. Okay. Okay, so at the moment, how active are you? Okay, so you've just started the gym. Well, that's fantastic. Well, that's a great step. How's it going? Oh, that's lovely. I'm glad to hear that. Oh, well done. Yeah, one step at a time. You take it easy on those knees, all right? And how many times are you going? Oh, wow, that's impressive. That's really good. So how's your food intake? Okay. Right, yes. Well, that's really good. That's a good start. Yeah. Oh, I'm really pleased. It's brilliant. It is hard, isn't it, switching? Yeah, definitely. But please don't put too much pressure on yourself, okay? It's one step at a time. Yeah? Okay, so just, don't punish yourself if you've, had something or anything like that. And please don't be too strict on yourself, okay? If we are, we're not going to stick to it. Yeah, and we want to be able to enjoy it. We want to get healthier. That's right, yeah, exactly. All right. Good. How's your sleep? How many hours averagely? Okay. So not too bad. Would you say it's disturbed sleep or? Yeah, I can understand that with your neck. Yeah, definitely. So that's obviously hindering sometimes when you're waking up in pain and things. Yeah. Alright. What kind of fluids are you taking a day? Oh, well, that's impressive. That's really good. And how much? That's a lot better than me. Yes. It's really good. Oh, of course. Yes. That's absolutely fine. Obviously. I mean, Sprite is a lot better for you than Coca-Cola. Yeah. Yeah, even the normal one rather than the, no added sugar and that. I think it's zeros and I'm not too sure. Yeah, so don't worry about that. I mean, if you're having one of those, like a little glass or something like that with your evening meal, I don't see that as a problem. Yeah. I mean, if you're drinking water every other, time and 1 cup of tea a day, that's great, and possibly some orange juice here and there. That's brilliant. That's really good. Yeah, honestly, it's brilliant. So yeah, you deserve that treat. I mean, I think the main focus is with you is building up your strength and obviously just getting healthier, getting your heart healthier and things like that. And gradually weight will end up coming down anyway and you'll probably end up toning up and things like that. That isn't my priority for you. My priority is just getting your strength up in your muscles and things like that, and obviously helping things. I'm not sure on obviously results and things, Dr. Nicola will go through that with you, and whether she wants any other tests or anything like that. Okay, but just from a point of view from our discussion, mine and Dr. Nicola, it would see that you need to strengthen up. Okay, I know it's very difficult with the fibromyalgia and the excessive pains and the sensitivity, but I do recommend that you try some swimming. Yeah, definitely. Yeah, because it's less pressure on your joints and you're using all your muscles, if you like, and it can be quite fun and relaxing in the water, so give it a go. Yeah? Okay. Okay, and I want to ask about your mental health. So I know you're on the mental health medications, but how are you in yourself, just generally at the moment? Yeah? Okay, that's good. Well, I'm really pleased to hear that. It's great. I mean, like I say, you do look great. Yeah, so you're quite stable, which is brilliant. I like that. And it's been, okay. It's been some time. That's really good to hear. Okay, so you're not feeling down or depressed. Okay, that's good. Any anger or rage? Any major highs or anything? Okay. It's good. Yeah. So you'd say at the moment your mental health issues are quite stable. Okay, so you'd say stable, no real issues mentally. Yeah. I mean, with your mental health diagnoses, they are issues that we know we can't cure, and sometimes talking therapies help, sometimes they don't. But I think somebody like yourself, it sounds like that the medication is helping and keeping you on the right track, so it's really important that you maintain that. Okay, and you said that it's not really causing any weight issues. That's really good, and I'm happy, and I'm sure your actual GP would agree that you're fine on the medication. All right, that's good. I know sometimes they can have issues with your blood pressure, but as you haven't had any issues with that before, I don't think it's that's causing it. Okay, and it could be a little bit of stress today as well, that you're feeling a little bit anxious about coming here, so that could have raised it a little bit. All right, yeah. Good. So I know this is a silly question, but have you been experiencing any stress or anything like that? I know it's life and things go up and down, but as it stands at the moment, how are you? Yeah, general life stresses, that's normal. Yeah, okay, and if you've got no issues with anything at all, anything you would like to discuss? Okay, yeah. Okay, well, that's really good. I'm glad to hear that. Yeah, so everything's going okay, there's no concerns at home. That's great. So they are quite supportive. Well, I'm glad to hear that. That makes things a lot easier. It's nice to have a supportive partner. Yeah, it's good. Yeah, well, I think that's really important, and having that communication and bond is, really important. And to be honest, not a lot of people have that. Yes, that's a really good thing. I would always encourage to have, good communication with partners. Definitely. I think we should always, talk about our feelings. It's so important. Exactly, whatever it's about, whether it's physical health, mental health, sexual health, anything like that. I think it's really important to talk about. Yeah, keeping that communication going, you know where you stand with each other, if you know what I mean. Yeah, exactly. Well, I'm glad to hear that. It's something really important. But at any point, if you do have any problems and you feel like you can't talk to your partner or friends or family or anything like that, I'd highly recommend that you do go to see your doctor or a nurse at your general practitioner's. Yeah, okay. Do you smoke or drink alcohol at all? If so, how much? Okay, that's good. That's very sensible. Yeah. Okay, that's great. Okay. So, do you have anything to ask me regarding your mental health? Okay, well, that's good. You sure? All right. Please note that if anything does come up, like I said, please make sure you go to your GP. All right, I'm sure you will, because you seem to have your head screwed on when it comes to your mental health and physical health and things like that. So I'd just like to remind my patients. Okay. Fantastic. Right. Do you have any questions about your physical health as it stands at the moment? Obviously, not what you'll be discussing with Dr. Nicola, but anything else? Okay. Yes, that's right. A lot of these things we can get with fibromyalgia. I mean, I'm not an expert on that, but I know you can get all sorts of different things with that, and it isn't the most pleasant of conditions to have. And I know that Dr. Nicola did say that it's quite advanced fibromyalgia as well, not more kind of early stages. Yeah, I mean, I believe you had a cranial nerve exam not so long ago, and yeah, that's right. Did they say everything was fine? Yeah, I'm not too sure. I mean, I think Dr. Nicola's going to mention that. I'm not sure. Yeah, which is really positive. Okay, and they didn't want any follow-ups. Oh, okay, so no scans and things. Well, that's brilliant. I'm glad to hear that. Yeah. Yeah, I know. I mean, if you are concerned or worried about anything, ask Dr. Nicola about, information and things like that on fibro, or any other things and things. So yeah, that's okay. Okay, so so you're more concerned about your knees at the moment as well. Okay, I'm not sure if she had a little look last time, or okay, well, I tell you what, when you see her, just mention your knees a little bit more and your jaw and things like that, and she'll be able to have a look for you. All right, it's not a problem. Okay, so don't worry about all those things. Yeah, but I mean, she's the best person to talk to, because it's just not my area. I mean, I know some things with working here at the practice, but yeah, okay. So do you have any other concerns? Okay, good. Right, so if it's okay with you, I'm just going to have a little look in your eyes, okay, and a little look in your ears, your nose, and your mouth. Okay, good. But before I do that, can I get you to just go and pop along and do me a urine sample? Okay, brilliant. So here is the pot. If you just go out to reception, the lady there will just show you where to go. All right, my lovely, I'll see you in a moment. You're all right. Good. If I can get you to just pop it on that table for me, and I'll check it in a little while. Okay, thank you. Okay, so I'm going to have a look in your eyes first, okay? quite bright. Okay, if I can get you to just look straight ahead for me. Thank you. You ready? Good. Just look up for me. And come back at me. Thank you. Okay, I'll just get you to blink for me. Okay, blink. Blink. Good, thank you. Perfect. Okay, I'm just going to get my otoscope and I'm just going to have a little look in your ears. Okay, let's relax for me, okay? Looks nice and clean and healthy. Other side. It's perfect as well. Okay, if I get you to tilt your head slightly, I'm just going to have a look at your nose. Good. Okay, open wide for me. Say R for me. Bob out your tongue. Colour up. And back out normal. Pop it to the roof of your mouth. Back to normal. In your left cheek. And your right. And back normal. Okay, can you just cough for me? Good. Can you just pull down your lower lip and your upper lip, pull it up. Good. And you can relax. Well done. All perfectly healthy. Teeth look really good as well. And gums look fine. Can't see any ulcers or anything like that in your mouth as well, so it's great. Eyes look healthy, ears look healthy and everything like that. I can't see any blockages up your nose, okay. I'm just going to have a little feel around your glands and your sinuses. Okay, am I alright to touch your face and your neck? any pain or pressure or anything? Okay, that's good. What about in your neck? Okay. Perfect. Okay, that's perfectly fine. I'm happy with that. Okay. So there's no swelling or anything, or pain, so that's good. Right. That's the checks all done and the questions and things. So now I'm just going to check your urine. Once I've done that, I'm then going to do a blood test and then you're ready to go. Okay. I'm just going to wait on that. That's all good. Right. Right, how are you with blood tests? Okay, well I would suggest not looking. Okay, just take nice deep breaths, okay? It'll be very slow, very gentle, but I'll make sure I get it done. Alright, good. Can I just have a feel around your arms? I'll start with this one. Okay, just pump for me. And this one. Okay, just pump for me. Just check. Okay, you can relax that arm. Just going to clean the area. Okay, if you could rest your arm just there for me, thank you. Okay, if you just look to the other side, nice deep breaths, okay? Just breathe with me. Okay. Sharp scratch now. Excellent, well done, doing really well. That's it. Oh, brilliant, well done. Nice breaths, nice breaths. Good. Excellent, well done. That's all done. Let's press down. You okay? Not too bad. Alright, that's good. Ah, lovely. Not really anything there. Pop that on. Perfect. That is all done. You feeling okay? Good. Right, so now you're ready to go. I've got all this. I will take all this information to Dr. Nicola, and I will also obviously get the bloods down to the lab. Okay, have you got a follow-up booked? Oh, brilliant. Oh, okay, that's great. That's perfect. Well, yes, that'll be here in the clinic. Okay, you're very, very welcome. Well, it was absolutely lovely to meet you. Okay, now you take it easy. All right, and just remember what I said. Okay, my lovely. You take care now. Bye-bye. Hello, lovely. How are you? Good. It's nice to see you again. How you been doing? Good. I'm glad to hear it. So, I have your results from the cranial nerve exam. Alright. And I believe it went really well. Okay. So there was no issues at all. The cranial nerves are working as they should. Healthy, no problems, no further testing needed. Which is brilliant. I'm pleased to hear that. Okay. Good. So you saw Yvonne, yeah, Nurse Yvonne, and she said you were absolutely fantastic and very pleased with everything. I've looked over all her comments and, you know, I'm very happy with everything. Obviously there was concern about your high blood pressure, okay, and your slightly high pulse rate, okay. The blood tests show that you have a high C-reactive protein, okay. Now that could be due to inflammation in your body, and it could also be if you're overweight and things like that, okay. Your cholesterol came up slightly high as well. Alright, I don't know whether you have ever been told that before. Okay, don't worry, it's fine. All this will be passed on to your GP anyway, okay? So, next thing. Okay, so your MRI results. We obviously examined the whole of your spine, okay? Now, there was a couple of things that actually flagged up, okay? So the first thing is you have a disc protrusion, okay? So protrusion is another word for a herniated disc or a slipped disc. Okay, I'm guessing you've heard of that before. All right, so that is at cervical 5 and 6. Okay, yes, so what's actually happening there is the disc has moved, and you can get bulging discs. This isn't a bulging disc, okay, but what's happening is, I will show you actually. This is my awesome little prop here. Now, this isn't from the cervical spine, okay, this is actually from the lumbar, but you get the idea. Okay, so you've got your vertebra, and here we have your discs, okay, spinal cord, okay. So what's happening? Basically, that is happening, okay. So you can get bulging discs which come out, but this, your disc is slipped slightly and it's pushing onto your spinal cord. All right, and that is obviously causing you excessive pain. All right, so like this, it's pushing on here. Now the good news is that at this stage we don't need any surgery, okay, which is really positive. Obviously it is resting on the spinal cord, which is what's causing you to have a lot of pain, okay, and the tingling sensation that goes down your spine, around your shoulder blades and down your arm, okay. That's because it's pressing on the nerve. Yeah, that's correct. So that's pushing, affecting the nerve, giving you all these pain and symptoms and everything like that, okay. Now at a later date, if it gets too severe and it's pressing too much on the spinal cord, okay, then we would have to look at surgery, yes, and basically removing the disc and things like that, okay. That's right, but at this stage at the moment, I wouldn't say it's pushing on it in a way that's going to be causing extreme problems, okay. Yeah, because unfortunately with the spinal cord, it's a really important area. Yeah, it's a very important nerve, so obviously we need to protect it as much as possible. But with the cervical spine, if there's too much problem, then it can cause us to be paralysed upper, and it can also affect our bowel and our bladder. All right, that's why I don't like to do surgery unless it's extremely necessary, because there's a lot of complications with that. Yeah, because that can obviously cause a lot of damage to your spine, and it can actually make you paralysed that way. All right, and we don't want to do that. And you are quite young, so I'd rather avoid that at this stage. All right, and because it's not totally squishing it, it doesn't need to be removed at this stage. Does that make sense to you? So I would like to start you on a course of physio. I think that is the best starting point, okay? But if it gets to a point and the physio is not really doing anything and it is becoming unbearable, then we could look at the option of surgery. All right, but that's going to be the very last resort. All right, does that make sense? Okay. Yeah, that's right. I mean, unfortunately, we can't reverse it. Yeah, and you know, physio can help relieve it. Yeah, the type of issue with the disc is actually, you know, we can't solve it. Yeah, that's right. So there's nothing we can do. We can strengthen the area. Yeah, which obviously we want to do. We want to try and, if you like, with certain exercises, sort of push it back, if you like. So it's here. We want to try and do something that we can push it back slightly to relieve it, okay? And you might find you'll get some relief, and then at some point it will start pushing again. Yeah, I mean, basically we're looking at about here. So phones, typing, tablets, playing games, working on computers and keeping our neck like that can happen. If you've had any car accidents, that can obviously trigger it, and different trauma and things like that. Okay, yeah, that's right. I mean, I wasn't sure about a disc problem, to be honest, but obviously it showed up, and yeah, but it does make sense with your symptoms. Do you understand everything I've said about the herniated disc? Okay, that's great. But please, if you do have any questions throughout this appointment, please just ask and I'll be happy to answer. All right, good. That was the first problem. The good news is you don't have ankylosing spondylitis, which is what I was concerned about. You are, however, positive for the gene, but you don't actually have the condition. All right, so that's a good thing. However, you do have what we call degenerative cervical spine or spondylitis. Yeah, so that means you have arthritis of the cervical spine. Okay, so that is this section here, okay, which is where you're experiencing all your problems, pain. Yeah, the rest of your spine is perfectly healthy. All right, at this stage, there's nothing else there. All right, so what's happening is your vertebra is obviously wearing down, okay, crumbling away, getting thin, and different things like that. Now, that could actually be causing trouble with this disc. It's not helping. Okay, so it's pushing it down, it's wearing away, and so that could be impacting it and making it worse. All right, and when you have this condition, it can also cause other herniated discs and possibly bulging discs and things like that. Okay, yeah, but yeah, degenerative, vertebrates are common, usually when you're older. Okay, so you are quite young for this condition, all right, and for some reason you are deteriorating in that area a lot quicker than you should be. Okay, now the good news is you don't have rheumatoid arthritis. That would have been a concern, but at this stage you don't. All right, so that's good. It is usually hereditary. Okay, so that's the good thing. I'm not really concerned about that. There is a few things in my mind that are a little bit could indicate it is, but it's not showing up on the bloods. All right, yeah. So no, that's right. It is irreversible, unfortunately. Okay, yeah, I know. I know it's not a good thing to hear at this stage. I know it can be quite difficult for you to take in. Okay, I know. Yeah, I know. I completely understand. All right, but you will be okay. All right. What we need to do is we need to strengthen you. Okay, we need to strengthen your spine. Now, I suggested physio because of your herniated disc, but it's also going to help with this. All right, give you some relief. People always say, won't using it make it worse? But physio is done in a way that can help you. And I'm not an expert in physio, so your best bet is to speak to a physiotherapist and they will actually help you and tell you a little bit more. Yeah, would you like to be referred to one? Okay, that's good. Yeah, they will talk through everything with you and, give you some moves and different things. I don't really know what they do, but they are very good with that. And I will put you in touch with a specialist that deals with these issues. Okay, yeah, they can carry out special massages and things like that, but I do recommend that you do have regular massages. Okay, yeah. Yeah, we need to try and maintain it, strengthen it, and just try to obviously, because obviously posture is a thing, but try to refrain from sitting like this all the time. Try to prop your head up. I mean, you can get certain little pillows now that maybe if you're sat, say, on the sofa or on a chair and you're working, you could pop one of those on it. It's not a proper, neck brace or anything, or neck collar. It's just like a little cushion, if you like. Yeah, they are recommended for this, so definitely check those out. You can get them on Amazon as well. They're fairly cheap. All right, yeah. Okay. Yes, that's right. So arthritis of the cervical spine and the herniated disc between C5 and C6. Okay, yeah. All right. Now, I said you have fibromyalgia, which you do, so you have quite advanced fibromyalgia. So obviously that means you're getting extra sensitive. All right, fatigue and obviously chronic pain throughout, and tingling and all sorts of different things like that. Okay, it's very, classic symptoms. And from what I saw last time, I would say you've definitely got some kind of joint hypermobility syndrome. Okay. Yeah, I mean, you're not fully flexible as a lot of people are, but there's definitely something there. And that's obviously going to be also impacting pain and things like that. All right. Yeah. Okay. That's correct. Yeah, exactly. All right. So far, have you got any questions? Are you sure? Okay. Yeah, it is quite a lot to take in. I do appreciate that. I know. All right. So that was that with the MRI. Okay. Now, I know we had some concerns with our knees, and Yvonne did tell me that you were concerned about your knees and you wanted me to have a good look at those, and you mentioned about your jaw as well. Yeah, and I know that we were talking about a lot of pain in our hips, our ankles, and like different joints around. I think that is partly to do with the hypermobility, but I am concerned if there's something else going on there. But I think the first step for me is actually to examine your knees. Right, so I'll just need you to either remove your trousers or roll them up for me, and I want to be able to see the knees and have a really good feel. All right, so while you're doing that, I'm going to pop on some gloves. Okay. Just jot this down first. So. Okay, so yeah, go on. Yeah, so I would maintain with your pain relief, okay? You may need to have some stronger stuff, okay? Stick to the heat on the area, definitely, okay? And we may need to look at some kind of anti-inflammatories as well, especially when we kind of had a real bad flare. Yeah, so for example, if you haven't particularly been doing anything, all right, and you're getting this pain, then I would definitely put it down to more fibromyalgia, okay? But if you've sort of been doing things and stuff like that, then we could possibly small the arthritis, if you like, or the slip disc. However, they both kind of work together, yeah, especially when you're very sensitive and you have these problems, it's triggering each other off, if you like. Okay, does that make sense? Okay, good. Okay, you're all comfy. Good. Alright, so let me have a look at those knees. I'm just going to have a really good feel around first, if that's okay. Do your knees ever get hot? Just on their own? Okay. What about swollen? They do look quite inflamed, but yeah, but obviously sometimes we're a little bit overweight, and obviously that can put pressure on our knees, and then obviously it can look sort of like swelling there, like edema. All right, yeah, but it can indicate other issues as well. All right, and obviously I don't know what your knees are usually like. Would you say that they've looked like this maybe since you popped on a little bit of weight, or? Okay, so you're not too sure about that. All right, that's fine. Don't worry. Okay, just pressing down your patella. I don't like that. No, very uncomfortable. Okay, what about when I move? Right, okay. Just going to touch around the side, knees, okay, and to press. Is that really painful? Okay, I'm so sorry. And there, that side, okay. All right, okay. What about there? Yeah, really bad there where it's the cartilage is, okay. Right, I want to just move your leg, okay. Quite stiff, yeah. Okay, just keep that there. Hurt. There. Okay. Just put that in that position, turn it out. There. And there. Okay. And this way. And there. Okay, I'm back there. So I can hear some of the sounds that you were saying, but you would say it's definitely worse if you're going up the stairs. Okay. Bending down and stuff, okay. Pop your foot there for me, thank you. Stay like that. Okay, I'm just going to sort of rotate. How's that feeling? Okay. Doing really well. Okay, good. Stretch it out for me. And we're about behind the knee. Tender. Okay. Tilt that way slightly. Thank you. All right, good. Okay, and there we go. Pop that there. Right, let me do the other side now. Okay, I'm just going to go over the patella. How's that? Yeah. Okay, what about when I move it? Alright. About where the cartilage is again, yeah. Which side's worse? Okay. Just going to go down the sides. Really tender, okay, I'm sorry. Oh, you didn't like that. You're right. Okay. What about this one? There. Okay. Yeah. All right. Okay. Guess I'm just going to open that up. Okay. There. Okay. I'll put that way. Okay, there. Move that way. really well, alright? I can see you're in a lot of discomfort. Okay, we'll pop that back that position. Good, that's it. Just going to move that slightly. Okay, back there. Okay, we'll just pop that out. Thank you. Okay, I'll put that back that way. Okay. What about behind your knee? Okay. So you're doing good. And that way. Okay, back in this position. I'm sorry, no, I'm shoving your leg everywhere. Okay. Yeah, it does feel quite swollen actually. Okay, okay, just get that up. Okay, and put that back there. Okay, relax now. All right. Okay, there's definitely some patella pain there. Yeah, I think it's best that we get you in for an x-ray at the moment. Yeah, I think we should get you down there now and let me have a look. I have suspicions, but I would like to get them confirmed if that's all right. Okay, good. So if you just rest here, I will go and get my colleague to come and do an x-ray. Okay, and then I will come back and have a look. Does that sound all right? Okay, perfect. So you're all right to sit here. If you want to have a look on your phone and just have some research, have a look on the NHS website and stuff like that over the issues that I've told you about. Okay, but just do watch what you're reading into. All right. Okay. Well, I'll see you shortly. Okay. Hello. You all right? Good. I'm Charlie, and I'm going to be carrying out your x-ray on your knees. Okay, I'm going to be doing both of them. Alright, so I need you to stay exactly where you are, and I'm just going to pop this special thing over you. Does that feel alright? Good. So let's open this up. Comfy. Good. Wonderful. Okay. All right. I need you to keep nice and still for me, and I'm just going to pop out the room. Okay, thank you. Okay, keep nice and still. Good. Nice and still. Wonderful. I can just move in that position there and that. Perfect. Keep nice and still for me. Okay, that's all done. Excellent. All right. Good. that is all done. So I'm just going to get Dr. Nicola to come and give you the results. All right, it was an absolute pleasure to meet you. All right, you take care. Hello, lovely. How are you? Good. Sorry to keep you. I was having a chat to Charlie, having a look at the x-rays, and she was telling me some things about your knees, okay? And she sent me over the report as well. So, you do have issues with your knees as expected. Okay. So, discussing all your symptoms and physically examining them and your results from the x-ray, I would say that you do have arthritis of the knees. All right. Yeah, I did expect something like that. Okay, so you have an infusion on both knees, but the right side is actually worse. So you've got fluid in your knees or on your knees, okay. And the patellofemoral joint is not seen very well, especially in the right, okay, because of all the fluid and the deterioration of the joint, okay. Yeah, so it's wearing down, breaking down more than it should be. And again, you are quite young for this. All right, okay. Then on the left side, it's the same, but you have these tiny osteophonetic lipping. Okay, so that means, in a nutshell, that bits of bone are coming off your joints and sticking into everything else, okay? They're like, if you like, it's growing off, okay? Now, these things are what we see with arthritis, okay? Yeah. And we can see that where your joints are deteriorating and wearing down, okay? You've got classic arthritis. You do have some cartilage there, but it is coming down quite a lot, okay? Yeah, they do need to be looked at regularly. I would suggest you coming back to me at least once a year to check out your cervical spine and your knees. Yeah, and with you talking about your other joint issues, as obviously I mentioned joint hypermobility, I am wondering whether you have kind of early stages of arthritis in the other joints, okay? As they're not causing you a great deal of problems at the moment, I'm not going to do any further testing on there. I've, put you under too much radiation at the moment as it is, so okay. But we're going to monitor that and see how it goes. You're experiencing a lot of pain with your patella, all right? So your patella is not quite in line properly, all right? And that's causing you a lot of problems, and that is your kneecap, okay? Yeah. Let me just show you my little model of a knee. Okay, so this is your knee joint. You'll find that you've got some wearing at the back as well. A lot of it will be obviously at the front, okay. So if you just look at the knee here, it's going to be going like this. All here is all wearing down, and that's wearing down. Here you'll eventually probably lose all your cartilage. Okay, so you'll be rubbing bone on bone. Okay. At a later date, probably hopefully a long time down the line, you'll be potentially looking at a knee replacement, okay? Yes, I would say so, but obviously we need to keep an eye on it and improve things a bit earlier to keep, that a lot further in the distance, if you like. Yeah, and we want to strengthen up all the muscles, okay? So all this problem with it wearing down here and here and here, it's going to be adding pressure all on your nerves, okay? And all obviously on the muscles and ligaments and tendons and all things like that, okay? So it's going to cause a lot of problems, hence we get a lot of pain. Obviously we use our knees a lot. Yeah, does that make sense? All right, so we need to have physio on them to strengthen them. Exercise, we need to strengthen those knees, lose a bit of weight around the knee area anyway. They're going to be quite swollen because of the arthritis, okay, and the water on the knees. Now, at this stage, I'm not too sure what you think about having a procedure to remove the fluid and to remove the lipping, okay, on the other knee. Yeah, I mean, it's going to cause quite a lot of, problems, and down the line it's going to get worse, okay. But I'm thinking at the moment, the first route is to have physio on the knees. If that kind of fails as such, we can look at getting that done. But you're going to be out of action for, a while, especially a few days without driving, but it could take up to a year to recover from the surgery, all right? It is quite invasive. Yeah, so we like to give a few months at least for you to recover on that. We'll have to see how you get on. All right. Yeah, and then obviously, you know, anything else will be further down the line. What are your thoughts? Definitely, I think that's the right way to go. Have physio on your neck and on your knees. I think that's the starting point. All right. Okay. I know that's a lot to take in, and I'm sorry to spring this on you, but at least we know what's going on now. So I would definitely say you're going to be getting arthritis probably in other joints at some point. Okay. Yeah. So it's very common in the knees and on the spine. All right, and especially the upper spine. It's because that's where we're always carrying our tension and things like that. Okay, and then obviously with the herniated discs, that's, you know, adding to the problems. I mean, if you look here, I know you can't really see here, but you can see that discs can thin. They obviously deteriorate, which is what's happening to you. You get bone spurs, which is also happening to you, but on your knees. You see a bulging disc, and then you can see here it's like splitting the disc, and it's popping right out into your nerve, spinal cord, which is a herniated disc. And they're all to do with like degenerative diseases of the spine. So that's obviously your arthritis. And obviously this is the ankylosing spondylitis, and that's obviously, you could see all the like discs are actually inflamed and stuff around there, which is another form of arthritis. Yeah, but that can cause all sorts of problems. But, you know, luckily we haven't got that. So do you have any questions, my love? Are you sure? Okay. Well, I would like to see you probably for a follow-up. Okay, I want you to have some physio. So I'm going to refer you. Physio here. Appropriate one for you, I'm thinking. Yeah, there's a couple I might send you to, but I'm just trying to see which one's probably the most appropriate. Could see Ben. He's quite a good one. Rosie's a good one. Dan could be a good option. And Isla, she's quite good. Yeah, I think we might go for Rosie actually. I think Rosie's probably the better one. Yeah, she's quite good with arthritis. Yeah, okay, I refer you to Rosie, I think. Okay, we shouldn't have to wait too long. Yeah, so I think we're going to start with that. So we're going to get you referred to Rosie for physio on your neck, your cervical spine, and your knees. Some sessions with that. Then I'm going to get you back to see me at some point, okay? That isn't a major rush, okay? But you have my contact details. I will email over all the reports and the discussions. On there is my contact details. You can contact me direct if you do have any questions or anything like that. Okay. I would suggest whilst you're at the gym, possibly speaking to a personal trainer, one that's actually qualified in like sports and things like that, not just necessarily fitness, okay? Yeah, so a good sports PT, I would say. Ones who've actually done sports therapy would be really good. And I think Rosie will be able to put you in touch with a PT. All right. Unless there's some at your gym that you go to that you could possibly speak with and see. Yeah, I mean, I don't know whether you've done a kind of routine with the staff there already, or... Okay, well maybe a starting point would be possibly to book in with one of the fitness experts or one of the PTs there and chat about everything we've spoken about, and they'll be able to help you and come up with a routine, I'm thinking. And if you wanted them to, they could like weigh you and they could take measurements and things like that, if that was something of your interest. And they can actually, if you wanted them to, liaise with your physiotherapist. Okay. Yeah. Which gym are you at? Oh, okay. Well, that would be very easy then for me to, you know, well, for you to liaise with them both. So, yeah, I would have to have a look then at who we have. I'm not sure off the top of my head. I'll have to get Rosie to do that. Okay. Yeah, we'll do that. So I'll speak to Rosie, get that sorted for you. Okay, I'll get her to give you a ring. And then she will discuss who the best PT there is. I know we do have a special sports PT here. And all knows about sports massage therapies and everything like that. So she will know the person's name. All right. And she'll sort that for you. Does that sound like a plan? Good. And there is a good nutritionist as well, which might be an option for you down the line. Okay, because we want to make sure that we keep healthy. Yeah, we need to lower that blood pressure, the cholesterol, all right, and that pulse, and get fitter and get healthier. All right, definitely. And all that's really going to help maintain. All right. Yeah, and obviously pain relief, you know, heat, and sometimes a little bit of ice maybe on the knees to reduce the swelling. All right, massage, definitely. Physio and all sorts of things like that are going to really help you. Anti-inflammatories and that, all right. But I'm here if we need to have a chat. Pick up the phone, book an appointment. It's perfectly fine. All right. Excellent. So, any more questions? I know I bombarded you, but I just want to make sure that you're aware of everything. All right, are you sure? Okay. Now you just go away and let, you know, digest everything, do some research. Yeah, and Rosie will be in touch. All right. You're very welcome. You take care now. Bye-bye.